Minoxidil oral.
Can you use the oral form of minoxidil? And the answer is absolutely yes.
El minoxidil oral.
I've been prescribing oral minoxidil.
Over 19,000 people took oral minoxidil.
Minoxidil oral.
The end of oral minoxidil is closer than ever. And I'm not kidding. A study published in September 2025 could mark the end of oral minoxidil as we know it. Undoubtedly, ever since the New York Times published this article in August of 2022, oral minoxidil has become the trending drug for treating alopecia and hair loss. However, no matter how astonishing the misinformation spread about this drug has been across traditional media, YouTube, and other online sites, the truth about its efficacy and safety within the scientific community is absolutely undeniable. Although different media outlets and some supposed informational channels have sold this drug as a new miracle against alopecia, the reality is that science has shown time and again that oral minoxidil is no more effective than topical minoxidil, and its use can lead to serious side effects. The latest study published on this matter only reflects the need to find a safer alternative to oral minoxidil for those people who, for whatever reason, cannot or do not want to use a topical version of the drug. Let's quickly review what science says regarding the efficacy of oral minoxidil compared to topical minoxidil. First, we have the 2020 study, which was neither a double-blind trial nor peer-reviewed. In this study, which analyzed 50 women with androgenic alopecia, the group of women who used 1 mg of oral minoxidil experienced an increase in total hair density of 12%, compared to 7.2% experienced by the group using topical minoxidil. However, the difference was not statistically significant. In case you didn't know, when the results of a study are not statistically significant, it means that we cannot know if the results are due to the protocol or treatment analyzed or pure chance. Imagine you toss a coin 20 times and it lands heads 60% of the time. Does this mean it's more likely to land heads when tossing this particular coin? No. To be sure that this difference in results is significant, that is not due to chance and that it's more likely to land heads, we need to toss it thousands of times. If these percentages are maintained after throwing it thousands of times, then the difference would be significant, and we could be sure that the coin is faulty or rigged and has unbalanced weight. On the other hand, if you toss the coin 20 times and it lands heads 95% of the time, this difference would also be significant, even tossing the coin only 20 times, since we're talking about the probability of getting heads being 19 times greater than getting tails. Again, we would know that the difference in results is not due to chance. Therefore, returning to the 2020 study, the important thing is that the difference in results was not statistically significant. Hence, we cannot conclude from the results of this study that oral minoxidil is more effective than topical minoxidil. This difference in results could have been due to pure chance. Now we must talk about a peer-reviewed single-blind study published in November 2023, which analyzed 23 men and 42 women, where 5% topical minoxidil was shown to have a better overall therapeutic effect than 1 mg of oral minoxidil, although again the difference between the two groups was not statistically significant. The authors of the study concluded that 1 mg of oral minoxidil may be as effective and safe as 5% topical minoxidil in male and female alopecia. Regarding this comparable safety of both drugs, the exclusions made by this study must be highlighted. That is, oral minoxidil may be just as safe as topical minoxidil except in patients hypersensitive to minoxidil, patients with a history of serious systemic diseases such as renal, cardiovascular, and hepatic disease, and patients with a history of hypotension or hypertension. The penultimate study comparing the efficacy of topical minoxidil with oral minoxidil was published in 2024. Specifically, this was a double-blind, placebo-controlled study, where the 68 patients who completed the study used either 5% topical minoxidil twice a day in a placebo pill or a topical placebo solution twice a day and 5 mg of oral minoxidil daily for 24 weeks. In this study, the patients who used topical minoxidil obtained worse than expected results, and the study authors point out that these results could be due to those patients not using topical minoxidil correctly, or to more patients in the topical minoxidil group experiencing telogen effluvium, 16% compared to 9% in the oral minoxidil group. Despite this, there were no significant differences in the main efficacy measures analyzed between both treatments. as the authors conclude, despite expectations of a huge superiority of oral minoxidil for treating androgenic alopecia, this treatment has not yet unequivocally proven to be superior to topical minoxidil in men or women. In fact, the conclusion of the latest systematic review of meta-analysis comparing both treatments published in April 2025 is definitive. Both topical and oral minoxidil promote hair growth. However, by results, topical minoxidil could be associated with a better improvement in hair density and fewer adverse events in comparison with oral minoxidil. Against this backdrop, the new study by Dr. Shapiro published a few weeks ago emerges. This retrospective phase 2 investigator-blinded study compared the efficacy of 5% topical minoxidil, 5 mg of immediate-release oral minoxidil, the traditional one, and BDPHL01, a new extended-release oral minoxidil formulation in 87 patients with androgenic alopecia. In this study, the use of 8.5 mg twice a day of extended-release oral minoxidil achieved a 2-point improvement in the frontal and vertex areas of the investigator global assessment scale, compared to a 0.5-point improvement in the frontal area with the use of 5 mg daily of traditional or immediate-release oral minoxidil, and a 0.29-point improvement with the use of topical minoxidil. It should be noted that these last two treatments were used for 6 months. Thus, as you can see, although the difference between the traditional oral minoxidil and topical minoxidil groups was not significant, the patients who used the new oral minoxidil formulation obtained significantly better results than the patients who used 5 mg of oral minoxidil and 5% topical minoxidil. These differences were further accentuated in the frontal area, where extended-release oral minoxidil was even more effective, almost 4 times more effective than traditional oral minoxidil, with 82.8% of patients achieving a clinically significant improvement, compared to 21.6% in the traditional oral minoxidil group. Something missing from this study is the terminal hair count of the analyzed patients, which could have given us a more objective metric of the results. Since the ultimate goal of this research is for the FDA to approve this new minoxidil formulation for treating alopecia, metrics such as terminal hair count will surely be considered in future studies. On the other hand, one of the most interesting points of this study is the use of a daily dose of 17 mg of extended-release oral minoxidil compared to the use of 5 mg of traditional oral minoxidil. The question that you must be asking yourself now is whether it is safe to use such a high dose of oral minoxidil. First, we need to talk about the side effects of traditional oral minoxidil. In a 1981 study that analyzed more than 1,800 case reports, 4.8% of patients suffered pericardial effusion, fluid around the heart. Of these 91 patients, 91 suffered cardiac tamponade, and 8 patients died because of it. Furthermore, the study analyzed 37 patients, 9 of whom suffered pericardial effusion and 1 suffered pericarditis. Of these 10 cases of pericardial disease, the authors found that the use of oral minoxidil played a causal role in 3 of them, including the case of a man who used 5 mg of oral minoxidil daily. It should be noted that the patients in this study used Lonitin, not a compounded formulation of oral minoxidil. The echocardiography revealed a significant effusion in 2 patients, and a small posterior effusion of no clinical importance was observed in 4 others. According to the authors of the study, patients who suffered pericardial effusion did not present specific characteristics that helped predict the likelihood of experiencing this condition. Furthermore, the authors point out that since this reaction is idiosyncratic and potentially fatal, the use of oral minoxidil should continue to be limited. An idiosyncratic reaction is one that is not dependent on the dose of the drug. Therefore, if pericardial effusion is an idiosyncratic reaction to oral minoxidil, it can appear even when using very low doses. In addition, we have recent evidence of this type of side effect from the use of low doses of oral minoxidil. Specifically, we have 3 case reports published in 2022. A 40-year-old woman who used 0.25 mg of oral minoxidil daily for 3 weeks and suffered pleural and pericardial effusion. Another healthy woman who suffered pericardial effusion a few weeks after starting treatment with 1.25 mg of oral minoxidil. And the case of a 52-year-old man who suffered pericarditis and peripheral edema after 2 weeks of using 2.5 mg of oral minoxidil to treat androgenic alopecia. Following up on this topic, if you're afraid to use finasteride or oral dutasteride due to possible side effects, I've just published the most complete book on this topic that will resolve any doubts you have and help you make an informed decision. I'll leave the link in the description. Against this backdrop, the study by Dr. Shapiro, whose results were published a few weeks ago, emerges. This study makes an explicit and significant mention of the side effects of immediate-release oral minoxidil, the oral minoxidil available today. In fact, safety concern is a central argument for justifying the development and potential superiority of this new extended-release oral minoxidil formulation. As expected, Dr. Shapiro's main concern is the risk of adverse cardiac events like those we've just seen. Furthermore, he explains that the greatest period of risk with the use of immediate-release oral minoxidil occurs with a peak concentration in the blood in the first hours after the dose. Dr. Shapiro also tells how he himself had to manage a significant adverse cardiac event in a patient in his own practice due to the use of immediate-release oral minoxidil. The new extended-release oral minoxidil formulation is designed precisely to avoid those peaks and troughs, keeping drug levels below those associated with the cardiac adverse events, making safety an additional advantage of this formulation. Ultimately, this new version of oral minoxidil has been created due to the existing concern in the scientific community regarding the side effects of oral minoxidil and the need to create an alternative for those who prefer to use minoxidil in pill form rather than topically. And as you can imagine, none of the 33 patients who use 17 mg daily of extended-release oral minoxidil experience serious side effects. Undoubtedly, this is a truly interesting research that could provide a definitive solution for all those people who would prefer to use oral minoxidil rather than topical, but who do not do so because they fear the possible side effects of the drug. By the way, if you want to know more about a new spray that could be 74% better than oral finasteride, you have to watch this video.